Pregnancy is an amazing process that affects almost every body system. Throughout the pregnancy, estrogen and progesterone levels steadily rise, and this leads to a bunch of anatomic and physiologic changes that happen throughout the body. Now, everything starts with ovulation, so let's call that day 0. On that day, in the ovary, an ovarian follicle, which is an oocyte or egg, plus its surrounding tissues, matures, and ovulation happens, which is when the egg gets ejected, while the surrounding structure becomes the corpus luteum, and quickly starts making estrogen and progesterone. Normally, the egg gets fertilized by a sperm within 12 to 24 hours. At that point, it forms the zygote. So let's say that fertilization happens a day later on day 1. Almost right away, cells start to divide over and over, until there's a ball of cells called the blastocyst on day 4. The blastocyst typically floats around inside the uterus for another day before it finds a specific spot to implant itself on day 5. Around this time, the corpus luteum makes a lot more progesterone relative to estrogen, and the low estrogen to progesterone ratio is necessary for implantation. At this early stage, there are 2 parts of the blastocyst, an inner set of cells that go on to become the fetus, and an outer set of cells called the trophoblast that burrow into the endometrium on day 6 and eventually develop into the fetal part of the placenta. Those trophoblast cells start to produce a hormone called human chorionic gonadotropin around day 8. And this is important for 2 reasons. One is that it's the hormone that lets the corpus luteum know that there's been a successful implantation into the endometrium, and that it should keep making estrogen and progesterone. It's this continued presence of estrogen and progesterone that suppresses other ovarian follicles from maturing. And the other important thing is that HCG is the hormone that most pregnancy tests are able to detect, causing that little sign to form which can happen as early as day 9. Without HCG levels shooting up on day 8, the corpus luteum would start to shrivel up by day 10, and estrogen and progesterone levels would fall. This would cause the lining of the endometrium to slough off, or fall away from the endometrial wall, resulting in a period, or menses. Now, a pregnancy lasts 40 weeks, which is roughly 9 months, but that's from the last menstrual period, which is usually about 2 weeks before day 0 of ovulation. So if you're counting from day 0, a pregnancy is only about 38 weeks. The reason for adding in the extra 2 weeks is that women usually know the date when their last menstrual period started, but have no way of knowing when they ovulated. So during the first trimester, which is week 1 through week 13, hormones are being generated by the corpus luteum, mainly estrogen and progesterone. By around week 9, human chorionic gonadotropin levels peak, and then start to fall off, which is a signal for the corpus luteum to finally start shriveling up. Luckily, just as the corpus luteum is shriveling up, the placenta takes over, and specialized trophoblast cells called syncytio trophoblast cells make progesterone and estriol, which is the most abundant type of estrogen. The placenta also makes a little bit of human chorionic gonadotropin, as well as another hormone called human placental lactogen, or HPL, which counters the effect of maternal insulin to help ensure that there's plenty of glucose available in the blood for the fetus. Now, a lot of the changes in pregnancy are directly related to the growth of the uterus. The uterus is normally a pelvic organ, but during pregnancy it grows into the abdomen, rising to the level of the umbilicus by 20 weeks gestation and to the xiphoid process by 36 weeks. The fundal height, which is the distance from the symphysis pubis to the top of the uterus, aka the fundus, is a good estimate of gestational age. For example, here at 36 weeks, you might expect it to be about 36 centimeters, but at 20 weeks, it's probably closer to 20 centimeters. To accommodate the needs of mom, an enlarging uterus and a growing fetus, as well as having some reserve for the blood loss that happens during delivery, the cardiovascular system has to expand. Pregnancy is called a high-volume state because the circulating blood volume increases by 30 to 50%, which means that an average woman will go from having 5 liters of blood to about 7.5 liters of blood by the 3rd trimester. Now, the number of red blood cells increases a bit, but there's a much larger increase in the plasma volume, which is the portion of blood that doesn't have any red blood cells. So the hematocrit, or percentage of blood made of red blood cells, actually ends up going down, and this is called physiological anemia of pregnancy. Alright, so to push this extra blood around, the heart rate goes up by about 20 beats per minute, so this ends up increasing the cardiac output. In response to the increased workload, there's a mild hypertrophy of the heart, which goes away after the pregnancy. This high volume state also explains why there's sometimes a third heart sound, or physiologic S3, as well as a split S1, which is where the mitral valve closes slightly faster than the tricuspid valve. Finally, the blood pressure actually falls a little bit, even though there's more blood getting pushed through them, since progesterone causes those vessels to dilate. Finally, as the uterus enlarges, it pushes up on the diaphragm, nudging the heart slightly upward and shifting the heart's point of maximum intensity a little bit to the left, and this is the spot where it taps against the chest wall. The uterus also presses against the pelvic veins, causing blood to back up, which can lead to varicose veins as well as swelling in the lower legs and ankles. When lying down, the uterus presses on the inferior vena cava, which reduces blood flow back to the right atrium and causes hypotension. A side-lying position or placing a pillow under the hip can help to avoid this. The increased cardiac output also means that there's more fluid going through the kidneys, and this increases the glomerular filtration rate and urinary output. Both that increased urine output with direct pressure on the bladder from the enlarging uterus explains why pregnant women have urinary frequency. It turns out that the kidneys compensate for the extra workload by increasing in size, which causes the calyces and renal pelvis to dilate, resulting in physiologic hydronephrosis. Also, the size of the ureters increases, which causes a physiologic hydroureter. In addition, progesterone causes hypomotility of the ureters. So the increased capacity to store urine and the hypomotility in the ureters can result in urinary stasis in the kidneys, and this increases the risk of an upper urinary tract infection. The lungs get affected as well. The uterus pushes upward on the diaphragm, which makes it harder for pregnant women to breathe comfortably. There is some compensation though, because progesterone relaxes ligaments in the thorax, which increases the transverse diameter of the rib cage, like a bucket handle that swings out, and the anterior-posterior diameter of the rib cage, like a handle that pulls up. These changes increase the tidal volume, which is the amount of air inhaled or exhaled per breath, and the minute volume, the amount of air inhaled or exhaled per minute. This ends up decreasing carbon dioxide levels in the blood, causing a mild respiratory alkalosis. It turns out that this mild alkalosis actually enhances gas exchange across the placenta, which makes it easier for the growing fetus to get oxygen. Finally, in the upper respiratory tract, estrogen causes increased vascularization and capillary engorgement, which can lead to nasal stuffiness, sinus congestion, and nosebleeds. In addition, progesterone and relaxin, another hormone produced by the placenta, both loosen ligaments around the sacroiliac joints and symphysis pubis in preparation for fetal passage through the birth canal. This results in the waddling gait sometimes seen during pregnancy, and these two can also cause pain in other joints, like those of the ribs and coccygeal or tailbone, all from shifting ligaments. In the gastrointestinal tract, hormonal changes cause smooth muscle relaxation and decreased peristalsis, which sometimes leads to constipation and bloating. It also causes relaxation of the lower esophageal sphincter, which can lead to gastric reflux and heartburn. A lot of pregnant women also experience morning sickness, which is nausea that typically happens early on in pregnancy, but can happen any time of day and sometimes persists throughout the pregnancy. Tastes can change too. Some women start disliking certain foods while craving other ones. A classic example is pica, where there's a craving for non-food items like ice, dirt, or starch. The exact cause of this, though, is unclear. Now, high levels of estrogen and progesterone can also affect mood, and the effect can range from mild irritability to severe anxiety and depression, all of which can be very unexpected. Many women also describe a mental fogginess or decreased ability to concentrate, which might be related to hormonal changes or general fatigue and sleep deprivation. During the pregnancy, estrogen and progesterone also promote breast development and the milk-producing machinery that'll go to work after the baby's delivered. Increased blood flow to the breasts and building of breast tissue might cause symptoms like tingling, fullness, and tenderness. Estrogen also stimulates the anterior pituitary to produce prolactin, a hormone that's responsible for milk production and letdown. Though the high levels of progesterone during pregnancy inhibits prolactin's milk letdown effect until the baby's born and estrogen and progesterone levels fall. That anterior pituitary gland also releases more melanocyte-stimulating hormone, which causes darkening of the areolae, or the skin around the nipples. The increased melanocyte activity also darkens the normally unseen stripe of fibrous tissue that runs down the chest and abdomen from the xiphoid process to the symphysis pubis, which is called the linea alba, or white line, transforming it into a darkened line called the linea nigra. Other glands that are affected by pregnancy include the thyroid gland, which turns out more thyroid hormone to increase the cellular basal metabolic rate in order to meet the demands of the pregnancy. Normally, women gain 25 to 35 pounds throughout the pregnancy, and that extra weight is mostly due to the increased blood volume, followed by the fetus itself, fat stores, the uterus, and finally the placenta. The extra weight and the forward shift in the center of gravity can cause lordosis, or lower back pain. Women can also get diastasis recti, which is where the uterus puts direct pressure on the rectus abdominis muscles, making them separate. In general, this pain can make it tough to get a good night's rest. Alright, as a quick recap. During pregnancy, both estrogen and progesterone rise, which causes a bunch of changes in nearly every organ system. There's an increase in blood volume, increased urinary output, shallow breathing, mood changes, nausea and changes in taste, darkening of the skin, breast changes, and loosening of the ligaments. It's good to keep in mind, though, that all of these things help prepare for the delivery of a healthy, tiny human.